the effect of the removal technique of complicated cosmetic iris implants on post-operative outcomes. Since 1991, posterior chamber prosthetic iris devices have been used to treat patients with aniridia or iris defects, whether congenital, surgical, or traumatic, with acceptable visual and cosmetic results. In 2004, the new color iris implant was introduced as a therapeutic device for treatment of iris defects, but was later promoted as a cosmetic device for the pure reason of changing eye color. This was later followed by the introduction of the Brightocular iris implant and discontinuation of the new color iris implant. Since their introduction, cosmetic iris implants have been associated with a series of adverse ocular complications, including cataracts, chronic iritis, secondary glaucoma, corneal endothelial cell loss, and severe iris atrophy. All of this has led the FDA and other organizations to issue a strict recommendation against the grave danger of using these devices and encourage their immediate removal due to their aggressive and sometimes irreversible effects on different ocular structures. When I met my first patient, I went on a search online mainly for finding the perfect technique to remove these implants. I found over 45 published articles between 2012 and 2019 reporting adverse effects of cosmetic iris implants. Only 3 of these described the technique for their removal. 2 of the authors encouraged the removal of the implant as a whole through a wide corneal incision, while one author suggested cutting the new color iris implant into 3 parts with excessive intraocular rotation of the implant. These techniques were found to be quite difficult to carry out and associated with many drawbacks, including wide wound-related complications and necessity for wound suturing, continuous shallowing of the anterior chamber during removal, excessive touch to the underlying iris, crystalline lens, and the corneal endothelium. And these are some of the techniques that I found, and quickly in this clip, you can see the excessive maneuvering inside the eye while trying to remove the implant in one single piece. Note that this is already a damaged eye, suffering eye. Again, excessive touch to the corneal endothelium and the underlying iris. All of this led me to asking myself another question. Can we find a better removal technique for these implants? And this is when I came up with what I would like to call the 5-slice technique. The main features are slicing the implant into 5 parts instead of removing it in a single piece through a small sutureless corneal incision, using microforceps and micro scissors through a single and using a single instrument inside the eye at a time. There was no rotation, flipping, or bulking of the implant during removal. And again, a short video of my technique. We start by 1.2 millimeter incisions, viscoelastic above and below the iris implant. Begin cutting from the pupillary to the limbal margin. This is a full-length cut. Again, another one to create a free wedge of the implant. And then I widened one of the incisions and delivery of the first wedge. In a similar fashion, we create a second wedge. At this point, we create the second side port, and the third wedge is removed. This is the 5th and final cut. And again, delivery of the 4th part of the implant, followed by delivery of the 5th part. So does this technique really make any difference? The objective was to assess the post-operative outcomes of different removal techniques of complicated cosmetic iris implants, whether removing it as a whole or removing it using the 5-slice technique. 10 eyes from 5 patients with cosmetic iris implants were divided into 2 groups. The first group consists of 4 eyes from 2 patients where the implant was removed in a single piece. In the second group, we had 6 eyes from 3 patients where the implant was removed using the 5-slice technique. We assessed best-corrected visual acuity, specular microscopy, and anterior segment OCT. They were all performed pre-operative, 1 week and 1 month post-operative. Our results showed the following. The first group had significantly lower best corrected visual acuity at 1 day and 1 week post-operative. There was a moderate difference between both groups at 1 month post-operative. Specular microscopy was quite hard to perform in the first group, whether 1 week or 1 month post-operative. In the second group, we had no significant difference between pre-operative and post-operative specular microscopy. Anterior segment OCT showed significantly higher corneal edema at 1 week and at 1 month post-operative in the first group, while there was moderate difference between pre-operative and post-operative corneal edema in the second group. These are some of the numbers. I'll just go quickly to the anterior segment OCT. It was one of the very prominent findings. This is before and after in removal, when we removed the implant in one single piece. Marked corneal edema, of course. And this was not the case in most of the cases in the second group. So again, does this technique really make any difference? We believe that the answer is yes. To conclude, cosmetic iris implantation is on the rise despite numerous warnings that they pose a serious risk ending in irreversible ocular damage. Removal may seem easy, but a bad choice of technique may actually add more insult to injury. No established removal technique addressing all safety concerns has been done to this day. Our technique provides better post-operative best corrected visual acuity and less post-operative corneal edema. Our technique relies on a small wound, a single instrument at a time inside the eye with no intraocular manipulation, thus being safer on the surrounding ocular structures with faster recovery and better long-term rehabilitation for our patients. We have submitted this technique to the Journal of Cataract and Refractive Surgery, and it's currently under it's under review. Sorry. Thank you very much.
Thank you, Dr. Ahmed. It's very important على فكرة درجة التسقيف بتاع الجمهور هتفرق في الجادجمنت، ليها بوينتس. لو عايزين ثانك يو للموضوع is very important لأن هو this is without يعني doubt this is now is a crime. احنا we started very early, we saw a lot of complications. And it's very important that we all know إنه حتى الناس اللي بتعمل دعاية لده all patients will get corneal problems, secondary glaucoma, later on cataract, and all of these patients are psychologically disturbed. They don't understand how serious to get blind. Thank you very much, Dr. Ahmed. Very nice technique.